begin. How are you, everyone? I'm Quinton Lucas, Mayor of Kansas City. We're here to follow up with some information that we had announced yesterday. As always, joined by Dr. Rex Archer, our Director of Public Health, who has worked with us throughout the pandemic. As we've noted before, throughout the pandemic, we have endeavored to provide clarity. We have endeavored to make sure we were consistent with guidance from the Centers for Disease Control and Prevention, from health experts, and so many others. We certainly noted that in our last order, our big effort was to make sure people were getting vaccinated, to make sure that we were encouraging vaccines. And that's why in the previous Kansas City order, you saw a relaxation of the mask mandate for those who were vaccinated and those who were in a room where they knew everyone else was vaccinated. It is my clear view that that would be helpful guidance nationally. But the CDC went an additional step beyond, stating yesterday, as we all saw and as we all recognize, that those who are vaccinated can go anywhere without having to worry about wearing a mask, with the exception of public transportation, airplanes, other such things. When talking about that order and what it meant for enforcement of Kansas City's order, we ran into a challenge, which is a clear one I think everyone recognizes. How can you regulate? How can you send our health department environmental health folks to enforce a mask mandate that is only applied to unvaccinated persons when vaccinated and unvaccinated persons may be in the same room, may be in the same area, may be in the same Arrowhead Stadium, or anything of that sort? And so we found, somewhat regrettably, that it is the most prudent option for us now to proceed to rescind our mask mandate and Kansas City's emergency order in its entirety. At noon today, you will see an end to the emergency order that has existed for roughly 14 months in Kansas City. There will be no mask rules that will be enforced by the health department, regulated industries, or other divisions of Kansas City government. What that does not mean, it does not mean that businesses cannot continue to have their own rules. People have called my office and others asking, what does this mean for schools? What does this mean for their local businesses? What does this mean for the neighborhood grocery stores? All the rules that existed for your schools, for your grocery stores, for your private businesses and enterprises can continue to exist. And importantly, they have the authority to continue to impose rules as they see fit to protect those who come within their doors. We do encourage people, particularly those who are unvaccinated. Step one is to get vaccinated. We continue to have a number of opportunities in Kansas City for vaccines. On the weekends, we continue to have an opportunity at Smith Hale School, that's in southeast Kansas City. Walk-in opportunities from 9:45 a.m. to 2 p.m. We also have an opportunity in the northeast of Kansas City tomorrow from 9 a.m. to 2 p.m. at the Mattie Rhodes Center. We encourage everyone, particularly now that we have vaccination opportunities for those who are 12 and above, to get vaccinated, to make sure that you are sharing the story of vaccinations, and importantly, to ensure that we are looking out for everyone else. Just because there is not a government regulation does not mean that we need to let our guards down from COVID-19. We have done exceptional work as a city. Our businesses, our restaurants, our retailers, and so many others have done exceptional work to look out for the best interests of others. We will continue to do that work. The health department will continue to be available for businesses in Kansas City, for schools and others who want to discuss how they can responsibly reopen. But what you are seeing today is that we're listening to guidance. We listen to guidance every step of the way, no matter who was the president, no matter what the guidance was. When the CDC was saying that we should reduce capacity, we did it. When the CDC was recommending stay-at-home orders, we did it. And now when the CDC is recommending that we go looser on mask mandates and other rules, we are doing that now. We think that is the most responsible way we can do things. A few anecdotes, I'll get out of the way, have Dr. Archer talk, and I'll come back for questions. Item one, I've said a few times, and this week I was in Washington talking to some of our leaders. The way I've seen it in Kansas City is largely that we've broken up our groups into a third, and a third. It seems as if a third of Kansas Cityans wanted the vaccine, were in a rush to get it, and have largely been vaccinated and gone through a full vaccine sequence. We're delighted that they have done so, and we hope, to the extent that they have children who are of the vaccination-able age, that they look to get those children vaccinated at any one of our walk-in opportunities as well. There is another third, however, of people that seem very unwilling to get vaccines. We will work with them. We will try to talk to them. I've actually had conversations, an interesting one with Senator Hawley and Senators Blunt, about how we've talked to vaccine-resistant populations. Often it's something where you're messaging with your family, telling them that it makes sense, maybe a conversation with your grandma, your mother, somebody else, and saying how this is important for you to do. I share the sentiment that I think was shared by both those senators and so many others, Republicans and Democrats, who have said vaccination opportunities are essential for us getting back to a normal way of life. But there's another third that I think is very important for us, and that's what the CDC, I think, was trying to address yesterday, and maybe they will. And it's that group that is perhaps on the fence or just for whatever reason has not gotten vaccinated yet. We can't implore enough how important it is that you go and get vaccinated. City government has continued to try to reduce those barriers to entry for people getting vaccinated. Walk up somewhere. Walk up to a grocery store. Walk up to any place where there's an opportunity to receive a vaccine. It is safe. It is good for you. It is the way that we can protect our families. It is the way we can protect our friends. And it's the way that we get back to a full normal, so that by next fall, next winter, next spring, we're looking at a world where this is a memory for us, but it's one where we don't have to go back to trying to talk about other ways that we can protect everyone even further, or other, God help us, rules that might need to be imposed or directed by the CDC. There's one other thing I want to note before I exit for a moment, and it's this. Throughout this pandemic, in western Missouri and eastern Kansas, there have been a number of folks, health directors and others, who have stood up for public health and science. And I include in that our school districts. I particularly will give a shout out to a number of our school districts in areas that didn't have mask orders. Those who are in other counties of western Missouri outside of Jackson, Clay, and Platte. Those who are in every county in Kansas except for Wyandotte, who held on to mask orders because they recognized none of their high schoolers, none of their middle schoolers were vaccinated. They stood strong with very tough dissension, and I commend them for that. There are also a number of folks, our health directors in the region, I want to recognize. Dr. Archer, we've mentioned a lot. Bridget Schaefer in Jackson County, Christina Heinen in Independence. In Clay County, Gary Zaborak. Pettis County, David Switzer. Platte County, Mary Jo Vernon. Cass County, Andrew Warland. And in Wyandotte County, Julianne Van Loo. Johnson County, Kansas, Dr. Sammy Ariola. It has been important for us to work with all of these folks along the way, and they have done important work to make sure our region is safer. Wear masks still. We're not throwing away our masks. In some ways, it depends on where you are. When I'm around a crowd of folks that I know have been vaccinated, that's a time where I'm more comfortable being maskless. If you're around a crowd of folks that you don't know vaccination status, or if everybody's unvaccinated, particularly if you're indoors, particularly if you're in a crowded space, still be smart and still be responsible. We'll bring up Dr. Archer, and then I'll come up for more questions.
Thank you, Mayor. So, got the typical good news and bad news with this change. The good news is that when you have 3 out of every 4 folks over 65 vaccinated, they now can be more reassured that they can go out and return to pre-COVID types of activities, because the vaccine, regardless of the variants that are circulating right now, is protective against death and hospitalization. The bad news is that for the folks that haven't got vaccinated, they are now going to be at higher risk because there will be less protections. The folks that were taking personal responsibility and getting vaccinated were also taking additional responsibility of reducing the chance of spread to those that weren't vaccinated yet. And until we had wide availability of vaccination, we were imposing that additional restriction on folks that had taken personal responsibility and been vaccinated, because guess what? Some of the variants are not 100% protected against still getting the disease. So you may not be getting sick enough to be hospitalized, but you can still get the virus, particularly with the Brazilian variant that we have going on some here in Kansas City right now. You can become infected even though you're fully vaccinated, and you can pass that on to others. If you're passing it on to other people that are fully vaccinated, then we're not having deaths and hospitalizations with that group. But if you pass it on to somebody that's not vaccinated, who now chooses to not wear a mask and protect themselves either through vaccination or other measures, then we will see those folks getting severe disease. And that's the concern that I have, is we've got to manage that message in a way that we help folks realize they now really, really need to get vaccinated, because before we had other ways to protect them, and those are going away now. So with that, we want to go to questions.
And we'll go ahead and start with questions. I may have a few other things to add, but any questions for you? Yes, John.
I know, Mr. Mayor, you said you're making this change to eliminate confusion and provide some clarity for businesses and employers, but I wonder if businesses in particular wouldn't prefer uniformity, because now you're turning the individual employer or business owner into the bad guy, so to speak, when it comes to establishing rules or restrictions within their environment.
So it's a fair question, and it relates to is in some way local government passing the buck down to businesses and others to now be the bad guy for having signs and saying people need to wear a mask. I'll just give you my foundational view of government. You have rules and you have laws that you can enforce. To the extent you want to encourage people to do good things, then sure, you say that, but you don't penalize people in certain situations where you can't fairly enforce rules and regulations. I will be exceedingly clear. I think that it is still important for unvaccinated persons who are inside establishments and close to others to wear masks. But what I cannot do is say that we are going to send a health inspector somewhere to potentially shut down a business because some folks are unvaccinated and some people who are vaccinated are there and an unvaccinated person is maskless. Without vaccine passports, without any of these other things, there's absolutely no way for us to tell. And the CDC laid out a rule that largely looked to a national honor system. And while perhaps that is laudable, and I believe in the people of Kansas City and the people of America, perhaps to hold up that part of the honor system, we are not going to give demerits based upon honor code violations. We just can't. And so I think that what we are doing is a reflection of the very real guidance. Perhaps some state and local governments will keep mandates around. I honestly don't know how they do so if they're actually following the letter of CDC guidance. And that's why I think this morning, actually last night, you saw the governor of Minnesota announce rescission of their mask mandate in the state of Minnesota. You'll see updated guidance from St. Louis City and St. Louis County today. I'm not saying that everybody will go the way the Kansas City order's gone, but I have talked to mayors around the country who said, how are you actually handling this order? I believe Memphis, Tennessee this morning also rescinded its mask order. I think this is just the situation and the framework that we are in now. That does not mean that we do not support wearing masks. What it does mean is that we need to do the next phase of what the health department largely is already doing, which is saying get vaccinated. We will create opportunities for folks to get vaccinated, and we will continue to note that anybody, and there's been this debate, I'm unfortunately on social media too much, right? And there are some who say, well, now no business can actually create rules that does not allow people who are unmasked to go in. That is absolutely false. Business enterprises, governments have an opportunity to still require masks. Kansas City government, by the way, if you walk into City Hall or if you walk into a community center, you are still required to wear a mask. That guidance has not yet been updated. I know the health director, working with our city manager, will look to what our next phase of guidance is. It is fully within the law for businesses to continue to have requirements that you wear a mask, just like they require you wear a shirt and shoes and all those sorts of things. And so that is something that we still stand by businesses that will do that. We're just getting out of the enforcement business in connection with these rules and issues. Yes?
What can a business owner do? How would you advise them if they have arguments, harassment, pushback, or just flat out people who disobey rules they've established?
Well, look, here's the thing. And first, I thank so many of our bouncers, bartenders, clerks at grocery stores, and others who have been terrorized over the last 14 months. We have seen it nationally and we've seen it here. People yelling at folks, people berating folks, people becoming violent to folks. It is unfortunate, it is irresponsible, it's ridiculous, and it's been embarrassing. I think that the same guidelines that you have now when somebody's acting a fool in your business are the exact same ones that you'll have with the rescission of this order, which is if there's somebody who's not not following the rules of a private establishment, you can ask them to leave. If they refuse to leave, you can engage law enforcement. If they refuse to leave then it becomes a stronger incident, and I would believe they'd likely be guilty of a trespassing type of offense. And so, absolutely, if there's somebody who is violent in your store, in your restaurant, in your convenience store, or anywhere else, I encourage you to call authorities and make sure that you deal with that person who's trespassing in the same way that you would somebody who you've kicked out for any other violation, for shouting in a movie theater or all those sorts of things. My hope is that people are responsible enough to know that there are rules. They still need to follow them when they go to places. But if they're not, then I would direct that to be your guide. One other thing that I think I would note in connection with all of these is still be kind to people too. There are going to be a lot of people who continue to wear masks because they feel unsafe out in the public. A lot of people who are vaccinated will continue to wear masks in different environments. I do not think they should be subject to derision. They should not be subject to any form of harassment. If you see somebody walking in the middle of a park with a mask on, I don't think there is any reason for you to shout at them, yell at them, mock them, or anything under the sun. Look, the story of 2020 has been an interesting one. There are lots of positive stories, but there are some negative ones. One of the negative ones was the division, a lot of the negative energy that I think we saw between folks. My view is let's bring an end to that. There is not a political mask, there's not a mask mandate imposed by a political body any longer in Kansas City. I think you will see them fall in other jurisdictions. Now's the time I think we look out for one another. We try to make sure that we support our businesses, and we try to make sure that we're getting more people vaccinated. Any other questions?
So, Mayor, at the beginning, you said that when you learned about the CDC order, you found it regrettable. Your word.
Yes.
Regrettable in what sense?
I think that the Kansas City order, and I've read writings from other scientists around the country and epidemiologists, I think that following an order that actually had an intermediate step before basically opening everything up would have been more responsible. While I understand the CDC's theory that they could just create a rule that says vaccinated folks go anywhere without a mask and everybody else who's unvaccinated will follow it, I don't know if that's the type of rule that was written in coordination with anyone who has been a governor or a mayor over the last 14 months, because it is the sort of thing where it is in some ways impossible to enforce a rule about vaccinated and unvaccinated folks when in our country we haven't actually taken the time to see vaccination rates increase even further, and when in our country we have no way of verifying whether people are vaccinated or unvaccinated. I wish there had been a slightly more collaborative and methodical process. That was not done in this situation. That's fine. I'm not the director of the CDC. I'm not a scientist or a doctor. I'm a lawyer and a mayor, and I understand laws, rules, and local government. And I understand local government was getting incredible demands. Our health department was getting incredible demands from the time the CDC issued the order from people saying, all right, mask mandates are done. And I think that in many ways, by having as broad a rule as we saw, they largely are. I do hope that folks follow our national honor system, get vaccinated so that they can protect themselves, their families, and everybody else in our country.
Mayor, you were talking about a pie being split into thirds.
Right.
People that got vaccinated, people who will not get vaccinated, and people on the fence. In some sense, don't you think that the people, that one-third you were talking about on the fence, have already made a decision? And their decision is, we don't want to be vaccinated, because they've had that option now for all of this year.
You know, I think the answer to that is no. As a person myself who sometimes doesn't avail myself of everything possible, right? We get free days at the zoo, for example, if you live in Jackson and Clay counties. I have never taken advantage of it. There are all types of things that you see people not... no, not necessarily. I think that it is fair to say that there is a third of people that really don't want to, and there are a third of people who just haven't. There are a number of reasons that you don't. There are a lot of people who don't get their license plate tags updated. It's not because they hate registering their cars. They may say, it's a pain in the rear to go to the DMV and I don't have time on Monday to do it. I've been in that position before, right? And so I think the same thing that we do in trying to remove some of the challenges for people to avail themselves of government opportunities, to avail themselves of paying tickets, of doing any number of other things, is the exact situation we make here. That's why we have done work to go door to door in certain neighborhoods neighborhoods and to make sure that we're saying there's a vaccination opportunity right down the street. I think that the time that I actually get updated on my own immunizations is the time when I actually go to the doctor. I don't go to the doctor enough, right? It's the sort of thing where we need to tell people it is easy for you to get vaccinated. We have these opportunities at your grocery store, at your corner store, that's where you do it. And I do think that that third is there that would say, you know what, if there's somebody giving vaccinations on the first floor of City Hall, and I'm one of the thousands of people in this building who work for Kansas City government, maybe I'm going to show up and get vaccinated that day. That's been the model we've used for schools and getting teachers vaccinated, the model we've used for so many other things, and I do think there's an effective way. I'm not disputing you. There's a third of people that probably just don't want to ever get the vaccine. Frankly, I think you still work on them. I have a sister who works for the U.S. Postal Service who, for whatever reason, doesn't want to get vaccinated. What that means is that, right, I will keep talking to her. I think we will keep trying to encourage her. But I think there's another big group that just said, you need to make it easier for us.
As a member of the Board of Police Commissioners, and I understand the political
Yes.
what would be your recommendation to the rest of the board and indirectly to the police department about how they should conduct themselves with masks?
We've said this a few different times. First, I've encouraged all Kansas City police officers, firefighters, everybody who interacts with the public to get vaccinated. And I'm proud of the fact that thousands of our city employees, be they with the Kansas City Police Department, Fire Department, or others, have gotten vaccinated. In terms of interactions with the public, I would think that the department will come out with directions as to how our officers can make sure that both they are safe and that the public is safe. I know your question is very simply, should a police officer have a mask on in every public interaction? I have not done the work either with Dr. Archer, the Chief of Police, or others to know what that full direction will be. I do think that we will continue to encourage, and I think the police department already has encouraged all of its officers to take advantage of vaccination opportunities. Back to the question, actually, we were just fighting about, we weren't fighting, that we were just discussing, the question we were just discussing, right? There were a number of ways that we got officers, some of whom were resistant, vaccinated, by making lots of opportunities where you could just show up, and if you were a Kansas City police officer or a firefighter, you could get vaccinated, right? That's the way that you actually get these things done. And so I think the best thing we can do to protect our police officers, our firefighters, and everyone in Kansas City is to encourage everyone to get vaccinated. The mask mandate is rescinded. And that means that every institution, including the Kansas City Police Department, our fire department, and others, will need to, through its administrative channels, look to whether that means they're rescinding their own mandates or rules related thereto. As of now, I have not seen that email come across from the Chief of Police, but I imagine that he's evaluating that as well.
Last question. Now, of course, this weekend, we're sending this today. You have Friday, you have Saturday,
Yeah.
parties and everything like that. What would your message be to essentially to the public regarding that? But this is, it kind of seems like this might be a test. Seeing Friday and Saturday, those are your big times to go out. There's probably going to be a lot of people going out. What would be your message to them?
Well, for those going out, the simple message is get vaccinated, take advantage of one of those opportunities. Believe it or not, for Mr. Mahoney, there was actually a vaccination opportunity at the zoo, so it shows that there's nexus in everything that I say. But more to the point, I think the real story is be responsible and be safe. Being out, so if you're unvaccinated, and if you have to go out, which you don't, but if you're unvaccinated and you're dying to go out, or you're celebrating your college graduation this weekend, which more than a few thousand young people in this metro region probably will be doing, outdoor events are much better and are much safer, right? We would still encourage you to be vaccinated before you go. But really the idea is just be smart. What we don't want to see is a bunch of graduation parties for high schools or anything of the sort, right, where you're going to have new COVID-19 outbreaks. Those are the sorts of concerns that we have. So try to be as smart, as thoughtful, and as responsible as possible. You know, I got flack the other day because I was in Washington, and everybody I met with, I believe, was vaccinated, at least, or so they suggested to me. With certain folks, I would respect what they had said and done. One of the congresswomen I met with preferred that I keep a mask on even though we were outside. So I kept my mask on. To me, it's just a matter of respect. Respecting the institutions you go to. There were others who said, you know what, we don't need you to wear a mask. That's the sort of thing that I would ask for. So if there is, I'm not going to use an active store, if you're going to the Woolworths down the street or the Montgomery Ward, right, and they say masks are required, just put on your mask. Don't yell at anybody. Don't fight at anybody. It just makes a lot of sense. That's what I would say this weekend. And if you're into revelry this weekend, just try to be as responsible as you can. And I think this is a sign for our young people. Get vaccinated. To talk like a young person, which I pretend I still am sometimes, it really sucks to be sick, right? It really sucks to get your family sick. And so please look out for a lot of people. Look out for the people like myself who have an infant at home, right? I mean, these are the sorts of things that I think we can do more of and that we can work on, and that would be our message long term.
Mayor, if I could-
Dr. Archer?
Yeah, I want to kind of drive that point home. There are folks that have transplants, chemotherapy for cancer, that even if they get vaccinated, they may not develop the level of immunity that they need. So, if somebody asks you to wear a mask because they're wearing a mask and they're concerned about their status, let's consider that, because you don't really know what that other person's background is. In the same regards, parents, you may be vaccinated, but if you've got a child that your pediatrician says has significant health issues, that getting COVID from the parent, because remember, you can still get the disease, but you yourself that are vaccinated are unlikely to be hospitalized or die, but you can still pass that on to others. So, yeah, let's be respectful of each other on this. And if somebody wants to wear a mask or asks you to wear a mask, is that big of a deal to be able to be supportive of that other person's request?
Dr. Archer, how big a shift will your department now undertake and be moving into public education? Because that's what the mayor was talking about, the three parts of the pond.
Well, I think probably you saw by my general comments that there's good news, bad news. For the folks that are taking personal responsibility to get vaccinated, they can start returning to these issues and not have the fear of dying or hospitalization. But for the folks that have not been vaccinated, whether they're in that hesitant group or the ones that just at this point don't think they're going to get vaccinated, they're now going to be at higher risk, because folks are not going to be protecting you. So it's educating, providing opportunities. As the mayor mentioned, a lot of people listen to their own doctor. And once they get in sometime over the next 6 months and the doctor's offices have the vaccine in their office and can give it to folks, we'll see additional folks that are hesitant now getting vaccinated. And if we see a surge because of these changes of hospitalization of those that aren't vaccinated, we'll be continuing to educate folks on that. So yes, we rely on all of you, as you've done through this last year and a half, cover these issues, help us educate the public that get vaccinated. It is the most important thing you can do right now.
Okay, thank you.
All right, thank you.